A lot of clients come to me when they've been told by other therapists that nothing can help them, or they've felt really just let down by, the mental health system in one way or another. And so the majority of my clients come to me on a range of hopelessness to suicidal ideation or a history of attempts. And so maybe they've done years of talk therapy and feel like they keep hitting a wall. The ketamine treatment really takes it to this next level and allows the client to do this even deeper work. I have seen clients go from suicidal every single day, living like a pretty productive life within 5 or 6 sessions. I have a client who hadn't been able to work due to the severity of their mental health struggles, is now working a part-time job. So it's been amazing actually to see the transformation. The majority of the clients that I have done CAP with, it has been really significant change in a relatively short amount of time.
But some of the things that I've seen from people are opportunities to sort of access grief, to access trauma, to find breakthroughs, if you will. So many people who've been in therapy for years and years and years, and it's been effective, it's been helpful, but they find that they're getting stuck. They've almost hit a ceiling, if you will. For so many people who've tried so many different kinds of medications, SSRIs and other sorts of psychotropics, they've felt like they've hit a wall because this thing hasn't worked and that thing hasn't worked. And for so many people, CAP seems to be the first thing that's actually helped them. It's giving them a bit of a relief from a mind that's been sort of torturing them for years and years and years, that's been impacting their ability to take care of their kids in the way that they want to, that's been impacting their ability to be engaged in work the way that they want to be, to feel a sense of purpose. And so CAP's been interesting that it's given people an opportunity to sort of break through that barrier, break through that wall, and find new ways of being. I can share an anecdote of a person who, in fact, is a therapist, was going through CAP, and they recently went through a loss. Their father had passed away, and CAP was the first psychedelic or sort of non-ordinary state experience that they had. And it gave them an opportunity to sort of face their father in their passing, which was really interesting because this was a person who was battling with their identity, where there was always this conflict with their parent. And of course, what we know is our early childhood attachments become the foundation, the platform for which we relate to other people and in which we can relate with the world. And so, of course, our parental connections, our parental attachments really shape the way that we see ourselves and the way that we might be able to maneuver through this weird thing called life. So for this patient, this person going through this CAP experience, feeling this sense of oneness, this sense of connection, being able to see and be with their father in a way that was non-judgmental, in a way that was compassionate, in a way that was loving, in a perspective that perhaps without CAP they might not have had before. All of this grief, all of this pain, all of this stuckness that they had, what they were holding on to that prevented them from being able to see their father who had passed in a different light, broke away. And it was phenomenal. And for an hour, just processing all of the years of the trauma, processing all of these emotions, it seemed as if for this person, they were redeveloping a relationship with their father in their past and in their afterlife, which was just a beautiful thing to see.
Each client that I've done this work with so far has come with very different challenges, ranging from, treatment-resistant clinical depression to complex trauma to acute anxiety. And I'd say there's something similar about all of the experiences, and that there is this deep connection with a knowing, not a knowing up here in the head. I know I'm loved, I know I'm lovable, yada, yada, kind of feeling that might have been present before, but it's a knowing that is either voiced during the experience or and felt. I know I'm loved. I know I'm lovable. I'm not those negative, broken beliefs that persist before. Something else that's really similar is the connection with nature, or the visual or auditory or felt experience of rising above and flying through the journey of the medicine, and yet a grounding sense and a sense of safety and calm. Those are some of the common things I've noticed, which is quite a relief for people that never can get there or feel they can never get there before this treatment, and haven't been able to. That's an opening. What I am noticing is some old beliefs might still present or come up, or limiting kind of thoughts or old ways of thinking. But what's different is that there's more of an awareness of it, an annoyance sometimes at it, and a willingness to make a change that wasn't happening before in their life with the people that are, giving them troubles or and whatnot. So there's I think so far a shift that can range from subtle feeling, but quite identity changing, so it's not that subtle, to major changes in life, ready to take the next steps or make huge shifts that wasn't possible before.
The clients that I have referred and have worked with have seen really robust change in their lives, and it's been a good and helpful partner in our therapy. There's a deepening that happens and a shift in perspective for the client, so they really do have a wider view of themselves and the world and what's possible. That's the default mode network, right? It's our the way that we see ourselves and see the world in this at rest state. And I see it shift. One client had very debilitating anxiety and really obsessive thoughts about what was making her anxious. And after a couple of sessions, that was really quite relieved. Interestingly enough, then some more depression set in, and then we started more working on that. And then that's also been, for the most part, lifted as well. Another client who had PTSD was able to really touch some core material, not so much the traumatic memory, but core meaning making that has really helped in our in the treatment of his PTSD.
I've seen clients who have been in years of therapy, who have been on every single different antidepressant or psychotropic medication. They've exhausted the system, and I have people that are coming in, knocking on my door, asking about, they're just at that point of desperation, unfortunately, of like, I'm ready for this to be over. I'm ready for a change. I'm amalgamating different experiences that have been highlighted through my experience, but a lot of them have been, being able to detach themselves from their current reality and being able to live and see their different reality from a different perspective, which allows certain emotional experiences to take place, which can reconcile an unsettling that was happening before the ketamine experience. And so the success in that is that they feel clear, they feel that they can make different decisions, they've reconciled, they've made their peace with whatever was challenging them and they were stuck in. And so it's a pretty powerful experience. I really believe in this medicine.
My first client I chose, she's medication resistant, and her psychiatrist has been at her wit's end. She won't try any new medication. She's kind of like done with trying new meds. And so that was causing a lot of hopelessness for my patient. And she's tried TMS. We did EMDR with her. She's in a trauma group. She just felt that she could never get down to that deep trauma and process that and really be able to acknowledge it and let it go. And so that was our intentions. We worked a couple of weeks on setting those intentions and which traumas, were we going to prioritize and go through. And our results have been amazing. And she's actually hopeful for the first time. I've seen her since 2019. And her depression, she's diagnosed bipolar, mixed episodes, mostly depression. And she's on disability. She can't work. Like, there's a lot of things that before going against this patient. And after our first session, we were hopeful, and she was able to process some things deep down that she's never acknowledged even, and never even shared with another human being, and just sobbed during the whole session. And she felt it was very therapeutic. We weren't sure how it was going to do as far as with her depression. And she's like 5 sessions in now, and she's doing great, and completely amazed with how her transformation has been going. So that was actually just truly amazing to see her change so much since I've seen her for so many years, to see her now be hopeful, and she's attending AA, and she's getting out of the house and doing things. And I'm just like, whoa. So that is my experience with my most severe patient. And we have done 2 others. One patient is very tightly wound, and her diagnosis is anxiety. And so her main intention was just to be able to let go and relax. And so her repetitive thing she kept saying during her CAP session was she feels like a noodle, and she felt really relaxed. And so we accomplished her goals. She was able to go home and take a nap, and she actually was able to just let things go for 45 minutes, which was amazing for that client. And so she was on the more of a functioning level than my previous client. And so to see the 2 spectrums and that they could help both was great.
This is a client that sought me out specifically to do CAP. And they had been suffering for a very long time with really deep depression and an eating disorder, had tried many, many different types of therapy, talk therapies, working with coaches, and sought me out for CAP. And they've just made amazing progress. I really noticed with the ketamine-assisted psychotherapy that it really attacks depression, and lifting out of depression can help clients tackle so many other things. And several people in this client's life that don't even know that they're doing CAP have noted back to them that they seem just lighter, more open. What I notice in counseling and therapy is we can go deeper. There's more space available to challenge the eating disorder and do real behavioral changes. And I've worked in eating disorder treatment centers before, and I know it's a very intractable illness. And so it's been really remarkable progress for this particular client after only about 6 CAP sessions.
One of my particular clients was a Marine veteran of 10 years, and also a police officer for 10 years as well. And when they were getting to the point of retirement, that's when they sought out using CAP or treatment. They had done talk therapy, they had done couples counseling, but a lot of substance abuse around alcohol being the norm for them to numb or self-soothe. This particular client had witnessed a lot of trauma during their time when they were in law enforcement, having to, witness people burned alive, things like that, like things that you can't unlearn. And it was very interesting because before leaving the military, this client felt okay. But after leaving law enforcement, because of the acute trauma that continuously happened, there was never any space between, whereas military, there was space between deployments. There was time to kind of come down a little bit from what they were seeing. And there was a validation of, I'm in the States, I'm okay. Whereas with law enforcement, this client couldn't come down because they were still in the neighborhood that they still worked in. When they would go out in public, the hypervigilance became so increasingly paralyzing that this client really avoided going to the grocery store, avoided going out for celebrations. And as we started working together, we focused on the integration first, really not pushing the medicine part. And this client had their own beliefs around it because ketamine, what they had seen was usually from the street. And so not really understanding how it could be beneficial, but curious. That was a big part of it. They were curious enough to explore it. And with that, we were able to do 3 sessions with ketamine, and they were able to actually connect with their old self, is how they described it, the self before the trauma happened, before all these experiences happened, and realizing that those experiences were not who they were. They didn't have to be hardened to hold them, and they were actually allowed to release them. And it was interesting to see the progression within, again, the family system, being able to be around their kids again, where they didn't feel like they were going to harm them with the trauma that they had, being able to talk with their partner about their feelings, which within the military culture and law enforcement culture, those are usually very, it's taboo to talk about that, but being able to express their grievances rather than having it get pushed down for so many years, or when they would have these blow-ups, and that was the big piece, was they were scaring family members at that point. And so being able to get them to a place where they felt okay to articulate their feelings in a healthy way, and then felt validated, that was huge. And I think that helped this client, and not just for themselves, but also being able to normalize seeking help for their colleagues, for people that they had served with. So within that, it was just a pebble, and it created a ripple within that person's community of healing versus holding on to the pain and suffering.
The CAP work that I've been able to engage in has supported me with helping patients with religious trauma, racialized trauma, immigration trauma. Given the magnitude of these traumas, the overwhelm, the multi-generational effects that the patients I'm working with are sitting with, the ketamine helps to untangle the threads so that we can work more specifically with one thing at a time. Also supported us with not feeling so pressured to move beyond the pain so quickly, because there's less pain and less confusion. With less confusion, we're able to organize our work better and truly achieve the outcomes that my patients are looking for.